At present, I have three different roles. My primary role is leading a research program that's primarily focused on normative adolescent development during the transition to adult life. And I also look at pathophysiology and translational intervention studies for depressive and substance use disorders during this transition. And I have a third line of research which incorporates primarily health disparities research focused on racial, ethnic, and gender disparities in adolescent behavioral conditions such as obesity and its associated complications like cardiovascular disease and type 2 diabetes, as well as pain experiences and responses. The second role I have is I am the diversity, equity, and inclusiveness advisor to the dean in the School of Medicine. So this position is actually appointed by the Vice Chancellor for Equity, Diversity, and Inclusion to different schools. It's a school-wide program, and I work within the school for School of Medicine, as well as I participate in committees that are campus-wide, particularly looking at STEM programs and making sure there is diversity in STEM programs. Then the third role I have is I have a joint appointment, which is an affiliate of University of California at Irvine. This is at Children's Hospital at Orange County. And there I serve as the Director of Education and Research. Part of this, I help coordinate, implement training of medical students that are actually from UCI, as well as child and adolescent psychiatry fellows. Also, I collaborate with both primary care physicians, whereas specialty physicians, to assist the programs overall in integrating mental health into primary care and specialty care and developing research programs there. I often get these questions, medical school versus neuroscience or psychology. Particularly until now, the brain was really sort of an enigma. But with the recent advances where we can do neuroimaging and a variety of other kinds of advances that have happened in psychiatry, I think this is a very exciting time. There is tremendous opportunity for growth. Then the second thing that I think is for people who are really interested in thinking holistically about the whole person, because psychiatry, I think, is the only specialty really that pays close attention to listening to their full stories and thinking about the person, like the mind and the body connection. When they ask about clinical versus academic, I often, of course, ask them to pursue their passion. But I also, having been an academic psychiatrist myself, so I give them information about some advantages. For example, women face a lot of challenges because this is an important period for them for raising their own families, reproductive years, right? Young women. And I tell them, like, so there are always challenges in terms of work-life balance. So there are opportunities, like if you are doing research, loan repayment programs to help you pay some of those loans, which are enormous as the years are getting by. And I also tell them, although each component is very hard and you need to work hard, but I think there is more flexibility in academia in the sense that if you're a clinician, you work 9 to 5 in the clinic, at least during the days that I was. Nowadays, there are evening hours and weekends, but primarily it used to be 8 to 5, whereas if you're in research, it gives you the flexibility of starting late or working at home early on. So I think that flexibility is also there. In terms of the research, it was a natural progression as I started to advance in my career and started to get my own grants and began mentoring others, although you did that right from the beginning at a smaller level. Then as the program grew larger, there were more trainees, etc. I've had invitations, and looking at those, they seemed really exciting opportunities, particularly to be able to help shape or help develop the next generation of clinician scientists as well as sub-translational scientists has been very rewarding to me. When I saw those opportunities, I found them to be exciting in the beginning and challenging in some respects. And so finally, like each of them was very rewarding. So this was almost like positive reinforcement to go to the next level. In terms of the role for the DEI, this was more serendipitous. Having come from India, I have had exposure to diverse populations, diversity in culture, religion, states, etc., which are very diverse in their own cultures, each state, languages, etc. And I at the same time saw real poverty versus utter riches there. But I never thought, although I saw that, I never thought the importance of my role in them. When I was initially a junior faculty member at University of California at Los Angeles. There I had the opportunity to work on a Center for Psychobiology. So I conducted some analyses and found that within normative populations, as you know, in California, we have significant diversity. So I looked at, for example, the things that we were doing, sleep and neuroendocrine studies or pharmacokinetic studies, they were vastly different. So this actually perked my interest in research. And again, both my clinical experiences and learning more and more about this research area, I found that there were very few underrepresented minorities in the workforce. So now I'm very invested in actually increasing diversity in workforce as well as working on these health disparities research in addition to eventually, hopefully, translate this to clinical care. SOBP has been actually played a very significant role in my career. For example, I'm a child and adolescent psychiatrist. So biological psychiatry gave me the opportunity to present my work in child psychiatry to the larger field of adult researchers, whereas I have always been involved in the American Academy of Child and Adolescent Psychiatry, but it's primarily the child mental health folks that are there. So this gave me a wider exposure, and then the connections that I made. Again, at the same time, it was a relatively smaller society then, so there was really good opportunities to network, both with the junior colleagues as well as mid-level and senior colleagues, and some of the connections that I made actually have stayed on lifelong, and we meet almost annually and get to know each other's not only work but also their families. So I have to say that I'm very, very grateful to biological psychiatry, and I have to indicate that the society has been very open. I think it started when Mary Phillips was the president, and I can say that now for 3 consecutive years we are having women presidents. So I think that's another important thing that the society has done. I have opportunities to mentor from undergraduate to postgraduate to junior faculty, and also individuals who serve as research staff, research assistants, who initially have completed a portion of their education. They're trying to get experience in between, going to graduate school or postgraduate training. So having that kind of staff who are invested in academic careers is also very fulfilling to see. Some of the things that I tell my mentees. So one is, it's really important to establish a nourishing mentorship relationship, and there are wonderful mentors, but at the same time, sometimes, particularly I think women and those that come from underrepresented groups hesitate to take initiatives. I think if you don't take the initiative in this relationship, it is a two-way street. The mentors can become disinterested, and that does not help you. So I want to, I tell them that they need to take their initiative. Then the second thing that I often tell them is to have like both short-term goals and long-term goals, and write them down really, actually. So, and then also the challenges that they're going to meet for those goals, as well as the strategies to have those goals. And then every few months, particularly for the short-term goals, to evaluate what you have accomplished, what you have not accomplished. And there are often times pressures, like professional, family, financial. And so sometimes it can deviate you from those goals. So that's why reevaluating them every few months would be helpful. And then in the end, if those pressures then take you significantly away from your eventual long-term goal, that's not going to be helpful to you. So you have to, again, work, particularly as a junior, you can discuss that with your mentors, and sometimes, occasionally, challenges could be there with your own mentors. But there are opportunities to also develop mentorships elsewhere. And that is what I think many of these professional societies do as part of their mentorship. This one, they can help you as an external advisor, how to negotiate these if you do have challenges with your mentors. Then the third thing I often tell them is, even though, again, it is really important to have a mentor and learn the skills, and I have benefited a lot because I come from India where there were no research opportunities at all, but I had a passion for research and wanted to be in academia. So for me, even though having that mentor is important, right from the beginning, I think what is important, particularly in academia, you need to demonstrate your unique contributions to a field. So I indicate that within the larger program, to develop a smaller program by that can be their unique contribution, that they can indicate that they made an impact, and that would help them. These are the primary kinds of things that I indicate, and particularly if they are women, right? There are different challenges. We talked about the reproductive years, and so there is this family work kind of balance. So sometimes, again, networking within the department and within the university with your peers to bring about changes. Like now there have been significant changes, helping lactating mothers, giving time off, or stopping the academic clock for tenure for women. So I think these all did not come about without asking of, without fighting for women. So I think finding those peer networks within the university and also externally, and to find out like how the others have negotiated, I think would be very, very helpful for women. And that helps them actually to get a work-life balance.